Hi, Mr. Johnson.
Good morning, sir.
Good, how you doing? So what's a day like for you?
I'll get up about 6:30 or so.
Patients' biggest frustration is access. Really try and do this leap to give people the care they need. Good, let's get the ball rolling.
Every clinician needs to look at their practice and say, what's the value to the patient? See how you keep your elbow here and then just rotate it out like that? Yeah, that's good, terrific.
How are you feeling since you got home? Since I started with the Center for Connected Care in this program, 100% of my patients are seen virtually. Can you show me again with your hand where you're feeling that pain? My team includes myself and 2 paramedics. If a patient needs to be seen, our office will send the paramedic to their home with an iPad. Paramedic does an assessment, then they take the iPad, they contact me, and then I connect with the patient that way.
Or is there anything you need from us?
A lot of the patients that I see are coming for second or third opinions. We figure it out and they go back home and they still need us as a resource. It's really grown to be great for the patient, the physician, and the medical team that I work with. This was a way of getting people the care they need without driving back up here, parking, missing work. It is a house call in a modern sense.
You start off saying that I'm going to look at patients who have chronic conditions or certain patients who I think I can evaluate adequately for a first-time visit. And I'm going to just do 2 or 3 a week. But I think you got to make a commitment.
The biggest symptom that's left isn't really pain or range of motion or anything, it's just it clicks.
If it's used at the right time for the right patient, it's a positive experience for both the doctor and for the patient. Just make a biceps muscle so I can see it on the right side.
I found that the virtual appointments enabled me to have more control over my schedule. To the point now we've actually templated my schedule slots for virtual.
I was skeptical that because of the distance, there were certain things that we just wouldn't be able to pick up. Does it hurt more when you're pressing on it? But using ExpressCare Online, I found that we're able to jump those hurdles because I am thinking more about how can I ask the questions I need to. Do your feet hurt all the time or only when you're up and about? Rather than having to use my stethoscope.
For me, the experience is very similar. I see a patient and they happen to be on a computer versus in front of me. I still feel the same connectivity to the patient. Is there anything new going on? Right there.
Right here. The bulge is out there.
Many patients today think that a virtual visit is even an option for them. Most people assume that they have to go see the doctor, regardless of what that takes.
What I've heard from patients is they appreciate not driving to the clinic. You know, it's a big deal.
Thank you so much.
All right, beautiful. Have a great day.
You too.
Bye-bye. See you soon.
Some of my apprehension was that the patients who we see would be resistant to technology, but what I found is that a lot of them actually embraced it.
There hasn't been a single patient that I've interacted with who found the virtual visit to be a negative. They've all found it to be positive.